Hello, I'm District 4 Councilman Ron Bowen, and welcome to another edition of PSL Living. And today we're going to have special guests to talk about hands, helping hands, like in a free clinic that serves St. Lucie County. And with me today is Dr. Andrew Passeri and also Kathryn Hensley. Good morning or afternoon. Welcome to
Good day.
Good day. Thank you. I had the privilege and honor of being invited earlier this month to a Founders Day dinner for Hands. Mm-hmm. I knew of Hands, but I didn't know what they exactly did, and I found out through the dinner that you're doing great work for a number of people here in St. Lucie County, serving the neediest of the needy in form of medical care and medical assistance. And I'm very impressed by the program and the number of recipients you've been able to reach. So I wanted to talk to you today about that and how it affects us residents in Port St. Lucie. So, Dr. Passeri, welcome.
Thank you.
Kathryn, welcome. And one of you would give us a brief overview or history of Hands and it's how it was formed and what it does in the community.
Well, about 4 years ago, it actually got a significant start. But it was several years before that a group of people got together and decided that this was one of the things that our community really needed. We had a gap of services for the working poor. So people from the county, the health department, the school district, Allegheny Franciscan nuns, or a whole group of people basically got together under the direction of our now deceased director of Department of Health, Larry Lee, and decided that this is what we could do. We could put together a program to start serving the working poor, and that we could actually make a significant dent in helping those people that need to be well in order to work. So about 4 years ago, it started, and since then it has expanded. It is comprehensive in mental health, dental, ophthalmological, general health services. So it is a very comprehensive piece. And then a couple of years ago, the pediatric dental component of that, which deals with the St. Lucie County school students and the early learning students, actually got an uptick, and now it is covering thousands of children. So it has made a really big dent. Dr. Passeri knows the numbers and knows the amount of money. As you know, I have a bumper sticker that says, if you won't do what's right because it's right, I can tie it to your pocketbook. And on this one, we can tie it to the pocketbook.
Well, again, you've made a great impact in the community, and I know Dr. Passeri, you coming on board has taken the Hands group and organization to the next level. And your thoughts on where the organization is now and where it's heading under your leadership?
Well, where it is now is in a survival mode, primarily because of the funding that we now work with, and that is the LIP grant, a low-income pool grant, which is part of the Medicaid funding that's distributed to the various states by the federal government. The federal government has decided that since they've expanded Medicaid or offered to expand Medicaid for the states, that would be the alternative to what we do, which in reality it isn't, and I'll get to that in a minute. But that they decided that would be the way to go, and they want to curtail or eliminate this low-income pool. We depend on that for about 90% of our funding currently. We do get some small grants from United Way, and we have in the past from Allegheny Franciscans. But most of it is from the LIP grant. So right now, my priority is to begin a program of development. And to that end, I've hired a development director. Some of you might know her in this county is Sydney Liebman, who's quite well known. And her task is to help, one, increase the awareness of what we do, and secondly, try to interest folks in this county to help support what we consider to be a very important community endeavor. Now, that said, we have the opportunity to expand our clinic even further in its ability to deliver more services to the residents of the county who are in need. The current location that we're in at the old Sam's Club up at the St. Lucie County Logistics Center allows us to expand a little bit within our clinic walls. And so certainly we could add some more capacity if and when the funding would allow. But currently we're trying to survive. That's basically what we're in. That's the mode we're in right now.
Well, hopefully through this program and all the other outreach you're doing, rally the community, number one. Number two, get medical professionals who are retired out of retirement to donate some time for the hands clinic.
Yeah.
And I'm not a big numbers person, but a couple numbers that did stand out to me when I went to the Founders Day dinner was, number one, I believe there was a third of the county is without medical insurance right now, or medical coverage, number one. And number two, the impact you guys have had already, 3,600 active patients you have right now. I think it was 18,000 people you've treated and impacted. Those were very impressive numbers. And also your mission is to treat people with preventive medicine or get the thing nipped in the bud before it becomes a major life-threatening illness. So your comments on your mission statement are just the numbers.
Yeah, it's a formidable task. And the need is very great, as you pointed out, in this county. There are 65,000 folks right now that don't have health care insurance in St. Lucie County. I saw an interesting statistic yesterday, and I've been asked this question a few times. Well, the Affordable Care Act was probably supposed to take care of this by expanding Medicaid. Well, in Florida, that hasn't happened yet. But interestingly enough, there was a national survey taken by the National Association of Free and Charitable Clinics. I just saw the published data yesterday. The state with the highest uninsured population is Texas. Now, they have not expanded Medicaid like Florida. But the second highest state with 3.5 million uninsured is California, and they have expanded Medicaid. And then third is good old Florida at 2.8 million. Now, that begs the question. Even with the expansion of Medicaid, see, that's the point that we have to drive across. The Obama program, or Affordable Care Act, is not a substitute that's going to assume the care of all of the uninsured. There are many gaps, even with the Medicaid population being expanded. So whether this state decides to expand Medicaid or it doesn't, there will be, at the end of the day, a pool of uninsured folks that are not within this safety net. The need for this clinic will continue. It will become even more germane as time goes on. And the impact it has on the county is not only in the humanitarian side that deals with the illness itself and the person themselves, but there's an economic impact, a huge economic impact. And that's the point that I think we have to make really well known. Because the tendency is, well, I've got insurance and I feel sorry for those folks, but what can I do? I'm one person. Well, let me put it in the economic perspective for us just for a second. If you have a sick population, or percentage of, and by the way, of those 65,000, more than half of them have jobs. So when those folks get sick and they don't show up to work, whomever they work for is going to feel the impact of that in one way or another. Lost productivity, whatever it might be. So there's an economic impact on the job side. There's an economic impact in the hospitals, because the hospitals become the first line of care for people without health insurance and no alternative way to go. So when a patient walks into an emergency room, it usually is at a point in their illness that they can't stand the pain or whatever it might be, to the point where they're sort of driven by uncomfortableness or the disease itself to seek care. At that point in the game, that illness has reached the stage where intervention is going to cost a lot more for a lot longer period of time. So if we can intervene earlier in the game, as we have, we see people with illnesses at the beginning stages, or we see them before the illness and try to prevent it. We keep them, one, out of the emergency room, and that alone has had a major impact in this community. You pointed out earlier that we've had over 18,000 visits in our first 4 years. Well, in St. Lucie County, one hospital emergency room visit average cost is $5,100. $5,100, and that data is 2 years old, so chances are it's even more. If you multiply that number by the 18,000 visits, you're coming up with $93 million of avoidable hospital costs that would have been incurred by those folks had they waited for their illness to become really serious and be treated in an emergency room. So there's an impact on the hospitals, and in turn you'll say, well, that's the hospital's issue. Well, it isn't. Because as a hospital administrator, I can tell you, what happens in a hospital when they incur that kind of debt is they have to find income somewhere to offset it. And what they do, obviously, is go to the people who do pay the bills and ask for an increase. So every insurance company that hospital deals with is going to be asked for more money than they normally would have, because they have to make up this bad debt. And therefore, your insurance premiums the next time around are going to be raised perhaps 5 or 6% more than they ought to be, had there been some earlier intervention somewhere else. We all acknowledge in this country that an emergency room is the most expensive place and probably the worst place to receive primary medicine. But that sometimes is the only opportunity and only option that folks have that have no insurance. We offer an alternative to be able to continue and sustain that for as long as it takes until something happens dramatically in the landscape of healthcare delivery in this country, which I don't know it'll ever be in our lifetime.
Well, an organization like HANDS is making inroads, number one. And number two, free clinics, Kathryn, are not new. You and I grew up in the 60s, and some of the cities,
Right.
large cities, I remember Cleveland had a free clinic.
Right, large cities are, I think...
It's not a new concept,
Not a
in
new
other words.
concept. For a community like ours, it was a new concept. Now, Martin County's had one for a very, very long time, for over 30 years, I believe. Their funding stream is a little different. They have more donors, I guess you'd say, that are willing to pony up some significant dollars. Our community, as I like to say, is not polo, we're more rodeo. So we need more people to donate smaller amounts of money, but by and large, we also need people to understand what we can do to help people to stay well, and what our community gets from that involvement, whether it be volunteering, spreading the word, or actually being able to write a check. But we need to make sure that our community knows there is an avenue for appropriate health care that can tie them up with whatever they need. If they have cancer, we have arrangements for cancer, we have arrangements for mammograms, for all kinds of testing and different things like that. So we can actually align them with what they need for the services they need to either get well or to stay well.
I heard a testimony at the founders' dinner of a woman who had cancer, and as a, can't use the word last resort doctor, but one avenue that was open to her was the HANDS clinic, and then he took her right to the, took her from the beginning to the end of the treatment.
Right.
Well, there are several stories like that. I've personally heard some from people. Unfortunately, I was too shy to come before the public and talk about them, but I had a fellow in my office just about 3 months ago, originally from Pittsburgh, had been a steel worker, got laid off, came here during the housing boom to find work, got a job, no insurance with the contractor that he worked for, but he was working and he did have some money, and he had diabetes, was able to afford his insulin and keep going for a bit, and then of course that ended, and his diabetes was left neglected. He was in really bad shape when he got to us. He's been with us now about 5 years, and he's alive and well, and his diabetes is well under control, and he's been able to be well enough to find employment elsewhere. So that's been a success. I think it's important also to acknowledge that 92% of the expenses we incur are provided through volunteers. Now that means that all of the physicians and all of the dentists are volunteers. It means that much of the work that we send out, laboratory work, is done by the hospitals, free to us. If we spend $10 million in expenses in a year, only about $700,000 of that is paid for through the grant. The rest of that money comes from volunteers. Volunteers in kind service and volunteers in providing service, but it's all done gratis. So 92% of the expenses we incur are absorbed through volunteerism. And I think that's a testimony to the people of this county who have stepped up to the plate, and maybe they didn't have a lot of money, but they provided service to us.
That's an outstanding statistic.
Yeah, it really is. It really is.
And being part of a big organization here with the city, I realize how important volunteers are. We have about 800 in the city, 300 in the PED, and 300 Parks and Rec, and any large organization for their success.
Yeah, they're an integral part of anything that you do. Yeah.
But let me ask you this question then. I want to hear from you, Kathryn. You have more room for more volunteers, and we're going to get the call out right now.
Absolutely.
Tell the viewing audience exactly what you're looking for in the volunteers and how they can make hand volunteer.
First of all, I'm looking for volunteer providers. I need more volunteer physicians. I need more volunteer dentists. Right now we have 6 dentists who donate some of their time to us, but it's not nearly enough. We have over 600 patients on a waiting list for dental care. Now, this is basic dental care. This is, drilling teeth and filling cavities and pulling teeth, and we don't do much else. And what happens along the line in dental care is that not only is it uncomfortable and sometimes downright dangerous in terms of infection, but eventually untreated dental disease leads to medical diseases like cardiac disease, big time. And so if you don't treat it at that point where it's probably relatively inexpensive, eventually you're going to be found with the sequelae of that disease, the fallout of that disease, that is going to be far more expensive and far more complicated to treat, in addition to the original dental disease. So, yeah, dentists I need. Right now our ophthalmologist retired, and I really do need an ophthalmologist badly. We have so much diabetes that we treat, and diabetes leads to diabetic retinopathy, a disease of the vessels of the eye. We have people with glaucoma that continuously need medication and to be tested for their pressure in their eyes. I'm sure there are people walking around that have undetected glaucoma because they haven't had a glaucoma screening test. So the need is up. We have needs for specialties, and we have some in some areas, but not enough. So that would be my first hue and cry: more professionals to come forward. I would beseech the medical society and the dental society to ask their membership if they could donate some time to us to help the 6 physicians that we have and the 6 dentists. And we have nurse practitioners that work for us also. But again, we can use more.
Well, so it's the old saying, if you ask, get the word out there. And Kathryn, you're very involved in getting the word out there. Your thoughts, and then maybe you could tell some of the viewers how they could get, the process and the process works of qualifying, or where they should go, some direction.
Well, and one thing that he didn't mention is that all of our professionals are in good standing. Okay, we've been asked that question before.
Well, it did occur to me that they weren't, but yes, they are.
Yes, they're all in good standing with their profession. So
yes.
we
requirement
have,
number 1.
Yes,
of course.
Correct. We have, when we see a need, we try to fill it in this community. It's something that's kind of unique in St. Lucie County. And so when we saw that need, people came together to try to fill the gap, and we need to be able to expand. We need to be able to make better inroads into that. People come in, anybody can come in. You make an appointment.
Okay.
You can walk in and make an appointment and come back, but you need to have an appointment to come. And then no matter what the issue is, people are treated like every other clinic, every other place, doctor's office. They're treated with great respect. They find out what the issue is. We don't tend to sort out what the financial issue is on first time.
Right.
Okay, so I know there's some issues dealing with finance and all that sort of thing, but when they first come to see us, they need our service, they get our service. So it's pretty much an open door policy, but you do have
need some verification down the road.
Down the road. But for the first stop, you need to either call, or some people actually will walk in and make an appointment for another time. Because I'll walk in the morning at 9 o'clock and the waiting room is full, and sometimes the overflow waiting room is full. So we are a very busy, active clinic. There's very rarely a dull day. But if somebody needs the service, come, make an appointment, come to see us. Somebody will take care of your primary care issues or to help you find out what your real issue is. And then they will make sure that you are lined up with the delivery services that you need for your special problem. We have a lot of people in-house that can serve a lot of those issues, but we also have a network of 52 or more different entities that will be willing to take reference for patients. So we have an agreement with Moffitt. We have all these agreements, and we're trying to build more agreements. Anytime Andy or any of us on the board hear of anything, we are, as always, a working board. We don't have very many figurehead boards in St. Lucie County.
I know they are working boards, trust me.
The follow-up to see if there's a grant opportunity to fill a need. We have a very large teaching program on how to handle your diabetes and nutrition and that sort of thing with the Department of Health. He's working on a new program now dealing with podiatrists for diabetics. That's a big issue. So anytime we see there's a need in the community, we try to figure out how we can help be part of the solution. And we did that with the pediatric dental care. So the shares and some of the funding came from Children's Services Council. United Way gave some of the funding. We know that if we can get to the children, we can also get to their parents.
Sure.
So that is a very helpful tool. Kids get toothbrushes, they brush their teeth at school, that sort of thing. And then we found that there's a need for the kids to be able to take toothbrushes home to their parents. Now, for some of us, we wouldn't even think that was an issue. But it is a significant issue in parts of our community. So we're trying to help resolve part of that because of our dental program at Hands, and then because we're working with children to help carry messages home to their families.
We've made quite an impact, and both of you have laid a great foundation in the past 4 years, and the next 4 years is going to be a very exciting time for Hands. I appreciate you being here to share your message, and hopefully this will be a rallying point for the community to really just get on board, Doctor, and Kathryn, and you've made an impact, both of you made an impact, the whole organization has, and hopefully we get the community behind you even further than they are right now.
Thank you.
Thank you. We'll be back in a few minutes with these important messages.